Our submission has two attachments. One focuses on some of the issues with the two evaluations for the cashless debit card. The other extends some of the analysis presented in our evaluation of new income management to look at contemporary community level outcomes for the Indigenous population in the NT and the impacts of income management. This second paper finds that despite the fact that around 1/3 of Indigenous people aged 15 years and over have been subject to income management for a decade, there have been no significant gains in child wellbeing, education, excessive alcohol consumption or crime. This is further evidence, we believe, of the failure of the mass implementation of this type of program. Finally, in looking at this data, we're aware that some of the statistics we use have been presented to the committee already, including the evidence presented by Professor Silburn on low birth weight. We note Senator Hughes speculated, and I quote from the draft Hansard, "We also don't know if perhaps that low birth weight risk has been mitigated through better nutrition, as young children, perhaps through securing a better diet with more fruits and vegetables, have more basic needs met through the provision of essential services as part of that income-managed quarantined welfare payment." In fact, we know much of the answer to this speculation, and unfortunately it is not positive. The question of changes in consumption associated with the Northern Territory Emergency Response Income Management was looked at by Brindlecombe and others in an article published in the Medical Journal of Australia, and reports, as with tobacco sales, income management had no apparent effect on fruit and vegetable sales. We looked at this question again over the latter period of new income management and reported in our evaluation firstly that fruit and vegetable sales were very low, in particular by people on Basics card, and secondly that detailed analysis of sales and communities found there was no positive association between the level of income management and fruit and vegetable sales. We believe that again this highlights the importance of taking an evidence-based approach to this policy. In conclusion, we iterate our view that decisions on this bill should be based upon the evidence, not upon anecdotes, discredited study or speculation. More so, we consider that the evidence we've presented on outcomes in the Northern Territory calls for real policy response, not the continued implementation of failed programs.